afternoon to all my good friends. How are you today?
Great!
Thank you.
Thank you for joining me today. Okay, I am Nurul Atika binti Mama Alias, and today I will be giving an important topic entitled scrubbing, gowning, and gloving. Okay, before we start, I want to show you a short video. Okay, from the video, can someone tell me what can you see?
A handsome guy.
Next,
A professional doctor.
what does he do?
Scrubbing, gowning, and gloving.
Good. The purpose for today's session is to provide ongoing education to scrub nurses on proper technique of scrubbing, gowning, and gloving. As we know, scrubbing, gowning, and gloving is very important to maintain sterile environment during surgical procedure.
Okay, our learning objective for today's session is define the key terms and concept related to surgical scrubbing, gowning, and gloving. Then explain the principle of the sterile technique in surgical preparation. Next, describe the impact of correct surgical scrubbing, gowning, and gloving techniques on infection control and patient outcomes. After that, demonstrate the correct surgical hand scrubbing, gowning, and gloving procedure. And last, determine common errors in scrubbing, gowning, and gloving techniques.
Why do you think we need to have a proper scrubbing? First is to decrease number of microorganisms on our skin. And next, to reduce microbial contamination of surgical wound. Gowning and gloving, why it is important? Because to exclude skin as possible contaminant and to create barrier between sterile and non-sterile areas. Now we go to the definition of the key terms. First is scrubbing. Okay, what is scrubbing? Scrubbing can be defined as the process of removing as many microorganisms as possible from the skin of the hands and arms before donning the sterile surgical attire. For gowning, gowning is the procedure of putting on a sterile gown to maintain the sterile feel. Now we go to the gloving. What is a gloving procedure? It is the practice of wearing the sterile glove to prevent contamination during surgical procedures. What is asepsis? Asepsis is the absence of pathogenic microorganisms that can cause infection. Okay, sterile technique is a technique for maintaining sterility and avoiding contamination when doing a surgery. Okay, last is sterile field. Sterile field is a specified area free of microbes and other pathogens. Okay, now we go to the principle of sterile technique. First, we have only sterile items are used within the sterile field. Sterile instruments such as sponges, basin, we can get from the sterile core. And sterile personnel are gown and glove. As we know, the sterility of our gown is from where, Muneh? From the chest up to the cuff of the sleeve. Okay, next principle is sterile personnel touch only sterile items or areas, and unsterile personnel touch only unsterile items or areas. Such as sterile team members maintain contact with sterile fields. Next, we go to other principle. The sterile field is created as close to the use of time. As we know, the sterile table are set up just before the surgical procedure. And next is sterile areas are continuously kept in view. Sterile personnel face the sterile areas. Okay, next is unsterile personnel avoid sterile areas because unsterile personnel maintain a distance at least 30 cm from any area of the sterile field. Okay, last. Sterile personnel keep well within the sterile area. Okay, such as when we want to pass each other, we have to do 360-degree turn back. What is SSI or surgical site infection? It is infected surgical wound that exhibit a local symptom like heat, pain, redness as well as swelling, and it might manifest a systemic symptom such as fever or increased WBC. Okay, what is the patient outcome if we maintain a proper scrubbing, gowning, and gloving? First, it can reduce infection rate because we can minimize surgical site infection. Next, it can improve patient recovery. As we can reduce the infection, patient will have faster recovery and shorten the hospital stay. Cost effectiveness because due to reduce the infection rate, it can prevent additional treatment and enhance safety. Okay, next we go to the demonstration of scrubbing, gowning, and gloving. Okay, what we need to do before we start scrubbing? Pre-scrubbing. First, we need to ensure we have a short fingernails. Next, we have to remove any rings, watch, or bracelet. And we have to wear a face mask, as well as we have to fold up our sleeve up to 5 cm above the elbow. Okay, now I'm going to demonstrate the proper scrubbing technique. Okay, first, what we need to do? Pre-scrubbing. Can anyone revise back? Okay, next. Okay. Last one is elbow. Alright, so as I'm gonna demonstrate, let me wear the face mask first. Okay. The items that we need for scrubbing, gowning, and gloving, we have face mask, antimicrobial cleansing agent, sterile brushes, we have glove, sterile glove, and we have gown and apron. Okay. For scrubbing, okay, first we need to wet our hand up to 5 cm above the elbow, and then dispense a small amount of antimicrobial cleansing agent onto our palm. Then we start our surgical hand scrubbing. First, we have to rub from palm to palm, okay, on the count 1 to 10. And then we have to move into from palm to the dorsal. If you start with the right, and then after 10, you have to move to the left hand. Okay? Okay, next, from palm to palm, interface like this. You count 1 until 10. Okay, if you finish until 10, you move from back of the finger opposite your palm with your finger interlock like this. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. After that, you use the rotational rubbing, okay, with your thumb flaps onto the left. If you start with the right hand, okay, and you count until 10, and then vice versa. Okay, do it on your left hand. Okay, next, rub in a circular motion, moving forward and backwards like this onto your palm. And lastly, with a circular motion, 4 centimeter above the wrist, and then next up towards your elbow. Okay, 5 centimeter above elbow. Alright, and then you continue with your other hand. Okay, our second step in surgical scrubbing. Pick a sterile brush using your elbow to push out the sterile brush, and then dispense a small amount of antimicrobial cleansing agent, and then you start a brush stroke 1 to 10 on your fingernail. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you have to rinse your hand, and you dispense again a small amount of antimicrobial cleansing agent, and you brush with your other hand until 10. After that, we rinse both hands, and then we need to dispense antimicrobial cleansing agent again and rub all our finger like this, that covering 4 plane. Each plane need 1 until 10 stroke, as well as our web of finger. Okay, start from the thumb to our little finger like this. Each plane is 1 to 10 stroke. After you finish, then you dispense again the antimicrobial agent, and then you rub in a circular motion until you cover up to 5 centimeter above your elbow. And then you repeat on your other hand. Then you rinse again. Make sure your hand is upright. Okay, next we perform the final hand rub on the palm until 5 centimeter below the wrist of both forearm until here. Now we go to gowning.
After finish scrubbing, holding one corner of the towel, open the hand towel full length and avoid touching sterile area. Start dabbing dry one hand from the fingers up to the 5 centimeter above the elbow. Then reverse the towel, holding the unused end of the towel, and repeat to dab dry the hand from fingers up to the 5 centimeter above elbow. Then discard the hand towel. Next, grasp the collar of the sterile gown, hold gown up and allow the bottom of gown to unfold downwards. And we can start to don our gown. Okay, now we can start to wear the sterile surgical glove using the close method. First, we need to keep our hands well within the sleeve. And next, pick the right side of glove using the left hand. And place the glove on the palm of the right hand. Make sure the fingers of glove are pointing towards the wearers. Right thumb of glove are parallel to the right thumb of the hand. And then stretch and unfold the cuff to cover the right ahead within the sleeve. and pull the glove to cover the sleeve. Repeat the procedure for the other hand. So this is the close method. Okay, now I will show you on how to wear the glove with the open method. First step is to glove your dominant hand. Next, slip the fingers on your glove hand under the cuff of the other glove and slide your other hand into the glove. Next, adjust the glove. Alright everyone, now we have done the procedure of scrubbing, gowning and gloving. Next, we need straw personnel to tie our gown. Okay, here are the common errors we make during scrubbing, gowning and gloving. For scrubbing, first, there is insufficient time where the person rushes during surgical scrubbing and uses improper techniques. As you can see here are the commonly missed areas. The areas highlighted in pink shows frequently missed areas during the scrubbing procedure, whereas blue indicates areas that are sometimes missed and brown shows the areas that are usually well cleansed. For gowning, usually the hands are raised above chest level. Next, a common error during gloving procedure is having the hands over the cuff, as you can see in the picture.
Okay, conclusion. Maintaining sterility in the operating room requires proper scrubbing, gowning and gloving. Following these guidelines reduce the chance of contamination and ensure patient safety.
Okay, now we have come to the practical session. I would like to invite any of you to come in front and do the procedure of surgical scrubbing, gowning and gloving. Anyone willing to volunteer? Alright, we have Hanem. Okay, Hanem, please come in front. now, we will tie our gown. Sterile personnel will tie the gown with the sterile personnel. After tie the gown, we maintain our hand. That's all for today's session. Thank you everyone.